people have plenty of problems with what we know already exists in House Proposal 3200. And there is plenty in there for people to be fearful of. What's even more concerning, though, to a lot of folks is what we don't know is going to be coming out. Yesterday, the president said on several occasions, my proposal, my plan, we, and the fact of the matter is, the president doesn't have a written plan yet. So the skepticism that you may see, hear, or feel here today is well-founded, because we don't know what he is going to put in writing. What we do know is what he has said, and that is, on one occasion, as he sat before an SEIU audience, that I am a proponent of, I support a single-payer program. And then just yesterday, he said, I've never said that. That's not what I'm about. I'll make one short statement and I'll ask you a question. I don't think that anyone here today would argue with the fact that we do need health reform.
Agreed.
I think probably what you would find is a consensus, a majority opinion in this room and across the country, that what is proposed is not going to fix the system, and in fact is going to make it a whole lot worse. My question very simply for you as the representative for AARP is, what more does AARP need to hear, see, learn about proposed legislation, in particular House Resolution 3200, to say that's not what we want? What more is AARP waiting on in order to say that's not it?
When you make a contribution to a particular candidate and to a particular party, then you are part of them and you are in their pocket. So I don't feel like that you're going to be representing us. One thing that I resent, we don't talk about the 253 million people that are happy with their plan. We always talk about the 47 million people that do not have insurance. Well, half of those people are eligible, but for some reason they don't apply or they don't get into the plan. Then we're talking about, and I'm talking about in particular, this bill, where we're having to pay for the people that are illegal immigrants here. There's no way that we're going to have enough professional people to take care of everyone. So it's got to be rational. And page 50, section 152, all non-U.S. residents, illegal or otherwise, will be covered. Now there's a lot of other things that may not be on.
And there was one more, I just want to get to this, and then I'm trying to answer everything you give me. The issue of rationing was brought up. There's been some concern that there's language in the bill that would ask for the government to set a minimum standard for insurance policies. This is because currently an insurance company can charge you a lot of money in premiums and not cover very much. The minimum standards that, in terms of what would be set for a policy would include hospitalization, primary care, outpatient hospital, mental health, substance abuse. If you are here and you have kids, it would cover well child and baby checkups. So this is to ensure that you're getting what you pay for, instead of finding out once you get sick that the plan you thought covered A, B, and C did not cover A, B, and C. And so I just wanted to clarify that piece. And at that point, I will go to the next question.
Let me remind you, we're answering these questions to the best of our ability. You recognize that we're not all going to agree, but please keep your disagreements civil.
Hi, my name is David. One thing I'd like to elucidate on something that you just said, in page 16, section 102, the so-called bill does say protecting the choice to keep current coverage. However, in lines 3 through 26 of the same bill, it outlaws private insurance by forbidding enrollment after H.R. 3022 is passed into law. Sorry, can you? Yeah, page 16 is the one that says that there's current coverage, so you're allowed to keep it. But on page, on lines 3 through 26, it outlaws private insurance by forbidding enrollment after. On page 167, section 401, it states that we're going to pay taxes, but they don't have to. This health care bill is for rationing services. You can read it on pages 494 to 498. My mother just passed away in April. She had dementia. I know that under this system, and especially with some of the advisors that Mr. Obama has, that are saying that I'm 55 and I would not even be considered to have as much worth as a 15-year-old. Now, of course, there's probably a lot of people that know me that would agree with that. But the only thing that I can say is that he has surrounded himself with people who, as a former professor of Western Civ in a local college, and someone who has taught public school and is a history major, I've read about the kind of people he surrounded himself with. And it's very last night at the meeting he was at, and she had a little girl that looked like she was severely handicapped. And she said that she wanted to have all the things that were going to come to her daughter. Well, there is rationing of the services to people who are special needs. It is in section 1177, page 354.
Let me clarify that one for you. Currently under Medicare, when the Medicare Modernization Act passed in 2003, there were plans that were created called special needs plans. These are for Medicare, Medicaid, dual eligibles. This is a program that serves seniors who are low income, so they actually qualify for Medicaid and Medicare. It could also serve people who are qualified disabled through Medicare. This is a special kind of managed care plan. It has nothing to do with individuals with special needs, and there are provisions that deal with how the special needs plans under Medicare Advantage operate.
Okay, but